Ataxia telangiectasia. What happened when the brain repair system fails? In ataxia telangiectasia, damaged DNA builds up inside the neurons. The cerebrum begins to degenerate, movement becomes unsteady, and the immune system becomes weak. This really show how DNA damage can directly affect the neuronal survival. Hi, my name is Dr. S, and today we're going to discuss ataxia telangiectasia. These are the learning objective of this lecture. The supportive care is very much important. Infection prevention, immunoglobulin, when in fact indicated, rehabilitation, surveillance, and genetic counseling. That is the disease description. It's an autosomal recessive disorder caused by pathogenic variants in ATM genes. Ataxia, poor balance and coordination. Telangiectasia dilated small vessels commonly visible on conjunctiva of the eye or skin. Multi-system impact of this disease, immunodeficiency, nervous system degeneration, recurrent spinopulmonary infection, radiation sensitivity, and increased leukemia lymphoma risk. Genetic and molecular basis, ATM gene mutation causes defective ATM protein, weak DNA repair, checkpoint failure, cellular stress, and tissue injury. ATM normally detects DNA double strand break and activates repair checkpoints and survival pathways. Long-lived neurons must survive oxidative and DNA stress for years. DNA surveillance allows genomic instability and malignancy transformation, especially lymphoid malignancy. Neuronal linkage, cerebral degeneration, cerebellum especially, Purkinje fiber, DNA damage, and that causes the ataxia plus poor coordination. The regions involving this is cerebellum, that Purkinje cells, cellular injury, and chemoreceptor, especially mitochondria, cellular dysfunctioning are very important in this disease. Clinical effects, progressive ataxia, primary dysrhythmia, and abnormal eye movement. That is the complete neuronal mechanism, ATM mutation, DNA repair, detect oxidative stress, Purkinje cell injury, cerebral degeneration, and progressive ataxia. That is the motor pathway consequences and the symptoms produced by these alterations in the genes or genetic makeup. Clinical features, gait ataxia, poor coordination, dysrhythmia, trauma, eye movement especially, and swallowing difficulty. That is only causes the uh, blood vessels to arrive in the conjunctiva or the skin, showing the neurological symptoms. Immune system IgA deficiency or combined immune problem might be there in these patients. Respiratory infections, chronic lung disease, cancer risk if the radiations are there for any evaluation of the disease and repeated X-ray especially. These are the other factors: growth delay, endocrine, metabolic issue, and radiation sensitivity. This is diagnosis: ataxia, in infection, AFP plus IG profile, ATM testing, and neuron plus immune care. Clinical suspicion, laboratory clues, especially the IgA that is tested from the saliva or serum. Confirmation, ATM genetic testing confirms diagnosis and support family counseling and risk assessment. Treatment, neurological support, physiotherapy, occupational therapy, speech, swallowing therapy, assistive mobility devices. Respiratory care, vaccination planning, immunoglobulin therapy, when indicated, chest physiotherapy, and pulmonary monitoring. Risk reduction, cancer surveillance should be there, genetic counseling, and multidisciplinary follow-up. Prognosis, especially in neurological causes, ataxia usually progress over time. Weak speech, walking, swallowing, and coordination often become derailed. Major complications, recurrent respiratory infections, chronic lung disease, spiration, cancer, leukemia or lymphoma, and nutritional challenges. Positive management factors are there if there is a early diagnosis of the disease, respiratory prevention, immune support, rehabilitation, cancer vigilance. That is the treatment map: ataxia, physiotherapy, occupational therapy, speech and swallowing, speech therapy, swallowing evaluation, aspiration, prevention, immune deficiency, especially IgA, infection control, antibiotics, immunoglobulin therapy, instructed patients, lungs disease, pulmonary monitoring, airway clearance, vaccination, and cancer risk evaluation, especially the avoidance of the radiation exposure in these kind of patients. Thanks for yours. Kindly like and subscribe the channel for further discussion on rare diseases. Thanks.